Here we go.
Rolling?
Mm-hmm.
All right. Hello, world. We've been trying to put up a video every week or so. We missed last week, sorry. And we want to put up a video about PANDAS/PANS, or what is called neuroautoimmune, infectiously driven neuroautoimmune encephalitis. These are two common terms for that over umbrella diagnosis, and it stands for pediatric acute neuropsychiatric disorder associated with PANDAS. That's the most common form of this. However, the umbrella condition to PANDAS is actually PANS, which is pediatric acute neuropsychiatric syndrome. And they're getting ready to possibly change these names and make people confused, but that's okay. We'll cross that bridge when we get there. But I wanted to talk about how it develops, why it develops, what happens, what are the treatment options, what happens if it doesn't get taken care of. Miss Amanda here brought up that good question. So it starts with a child that has chronic and recurring infections. It can be streptococcus, and if it is streptococcus, then it is called PANDAS. Having chronic infections with strep does not mean you have this, but if you have all the other symptoms and laboratory markers that we'll go over here in a second, then it is PANDAS. If it's a different bacteria or virus, then it's technically called PANS. Anyway, it starts with a kid with chronic infections. They wax and they wane, they come and they go. They start having symptoms of sore throats, cold, flu, cough-like problems, all of the usual when it comes to fighting off an infection. However, what happens is these kids will stop showing signs of having stop showing signs of outward infection signs, and what we end up getting is it kind of translates into not so much the outward symptoms, but a sudden onset of more psychological and psychiatric symptoms. Now, the symptoms are going to be abrupt onset. They can literally wake up in the middle of the night or wake up in the morning with a out of control OCD problem. They can have anxiety that just comes out of the blue. They can have depression or a decrease in cognitive functions. The parents of the children that I have seen with these various cases have been something as far as they wake up and they literally cannot remember what they learned in the last few weeks of school. They wake up and they have obsessive compulsive disorders associated with clean hands. They don't want to touch doorknobs. They have to say certain words 3 times in a row. Something as mundane as they have to turn around 3 times before they sit in a chair. It could be anything. But the key is it is sudden and is just coming out of nowhere. It usually just doesn't build over time. It is in your face, brand new. And a lot of my patients have actually woken up with these things. In really awful situations, these are kids that will have to go to the hospital or the psych ward, which we'll talk about in a second. So how does it go from fighting these chronic infections to why are they all of a sudden having psychiatric issues from chronic infections? That comes from a concept called molecular mimicry, and down to the protein structure of our DNA, our cells. The immune system is mistaking what strep looks like or mycoplasma looks like at its molecular level for certain structures in the brain. So when you line up these structures in the brain or you line up what the DNA looks like in the brain of certain structures, and you look up and you line up what the DNA looks like or structures of certain pathogens look like, and you put them under a microscope, they're going to look pretty similar. Because over time, the immune system has lost its ability to specify what is a pathogen and then what is tissue. And if it looks enough alike, like a dark blue and kind of a lighter blue, then the immune system is going to say, oh, I don't know, it looks close enough, we're just going to go after it all. And that is autoimmune 101, and that's what's happening with these kids. Now, It happens to be just going after the brain. In kids with autoimmune problems like type 1 diabetes, this is the same mechanism that we're finding out that occurs in type 1 diabetes, same mechanism that can be found in what they used to call juvenile rheumatoid arthritis, or what they now call idiopathic juvenile arthritis. Either way, similar mechanisms are being theorized to be applied to those situations. This is happening in the brain. Now, why is it that they're having these really bad psychiatric symptoms? It happens to be that the areas of the brain with the most amount of blood flow and brain activity is where the attack is going on. And that makes sense because if the pathogens are getting into the brain, or the immune molecule cells that are fighting off pathogens are breaking the blood-brain barrier and getting into the brain, then it's going to go and it's going to cause issues in the areas that have the most amount of blood and most amount of activity, which happens to be the basal ganglia, brainstem, cerebellum, areas that are just flooded with blood on a almost regular basis. So what do you do about it? Well, this is, there's a whole lot of research out there that can be looked at, but this is where antibiotics are going to be necessary most of the time if it is a bacterial infection. IVIG, or what is called an IV drip of immunoglobulins or immune cells. So what happens is they do this IV drip, and it's dripping in immunoglobulins, so it's essentially filtering out your immune cells so that it can better fight the infection and get rid of the high antibodies going after these pathogens. On the functional neurology side and functional medicine side, we can do, at a certain point when they can accept the therapy, we can do functional neurological protocols to help slow down these very hyper overactive areas of the brain, and we can give certain supplements to help balance out the immune system. For the other treatments such as antibiotics and IVIG, and very, very bad situations where they have to use things like rituximab and other actual chemotherapy agents, we can still apply natural remedies to help balance out the immune system, because this is essentially an immune system that's gone haywire. It's like a teeter-totter, and that teeter-totter is not balanced. And certain supplements and certain brain activity exercises can help balance out that teeter-totter for the long run to help get this taken care of. Now, unfortunately, what we're finding out is sometimes these kids, when they have all of these very bad psychiatric symptoms, these are kids that end up in the psych ward, and these are kids that may never get out, because what happens is the pathogens, the levels of antibodies, or the levels of the infection come and go and wax and wane. So they end up showing signs of great success. Then, out of the blue, maybe it has been bad weather, stress in their life, not wanting to deal with the doctors or whatever that's going on in their life, their immune system takes a dip, and therefore they take a dip. So the immune system rams up the antibodies, and the molecular mimicry rams up, so you have more autoantibodies, and the psychiatric symptoms kick in again. And these are kids that are more or less trapped in these terrible, terrible situations. These are the worst of the worst. The severity of this can come and go, but the key of figuring out if your child or your issues of typically these symptoms are being ran by an infectious agent that has ran up your immune system enough to cause molecular mimicry is if it comes and it goes, and you had a sudden onset of it. A lot of times these people have underlying minor issues, but then when it just suddenly rams up out of nowhere, this could be a mechanism. And to learn more, I would go to pandaspPN.org, or molecularlabs.org. And to learn more about testing and how to get it figured out, by all means, just give us a call, and we can guide you in any way possible. If we can guide you in any way possible, we will. Thanks.